All right, I'm just gonna go over the home care instructions for Stony. All right, I've got them written down, but I'm just gonna go through them with you and add a little bit more stuff, and you'll have it as a reference if you need it, along with these written instructions that'll come home with you. But most importantly, I've included the office phone number as well as my personal cell phone number here at the top. If it's after hours or evenings, weekends, don't hesitate to give me a call on the cell phone. We can help you out, okay? We talked about it the other day. I want him confined to a room or a small area for the next 6 to 8 weeks. I don't want any jumping onto a counter height level. I think couch level is okay, but no counter height. And then no running or jumping or rough play. We're gonna send you home with an ice pack. I want you to try to ice his arm 3 or 4 times a day for the next 3 days. That's gonna help with swelling and bruising a lot. Now there is an incision on his arm, but there's no external sutures. He is coming home with one of those cones because I don't want him licking or grooming his incision. That's real important. He grooms and opens his incision. That can cause an infection, and that can be very difficult to deal with. So let's keep the cone on until about 2 weeks post-op. At 2 weeks post-op, I want you to take a picture of his incision and some video of him walking, and I want you to text it to me. I'll be back in touch with you, and we'll discuss what to do from there. But we do need to plan at 6 weeks after surgery to take some x-rays of that arm. All right, you'll call and schedule that for 6 weeks post-op, and then we'll base his restrictions off what those x-rays look like. Medications, he's coming home with 3. The Ulna is a non-steroidal anti-inflammatory drug to help with discomfort. For cats, we can only give it 6 days in a row. He's had some here in the hospital, so we're just going to continue that until it's done at home, and that's a once-a-day medication. Okay, the gabapentin will help with discomfort and offer some sedative. It's 1 capsule every 8 to 12 hours. Here in the hospital, we're giving it every 8 hours. I would continue on an 8-hour dosing schedule. It's going to help with sedation, especially for this first week or so. And then he's coming home with an antibiotic, Clavamox. It's going to be 1 tablet every 12 hours. Here at the hospital for 12-hour medications, we give it at 6 a.m. and 6 p.m. So his next dose of antibiotic is at 6 p.m. The Ulna also goes at 6 p.m. Okay, the gabapentin is every 8 hours, and you can just kind of use your judgment on when to give that. If you have any questions, give me a call.